and sports injuries, prevention and treatment.
I keep spraying my ankle. Don't worry, I'll treat it with rice.
Rice is a formula: rest, ice, compression, and elevation. Stop your activity immediately and rest. Then use ice to keep swelling down, and to ease any pain. Compression means putting pressure on the injured area to reduce swelling with a wrapped bandage. Elevation involves raising the injured part, also to reduce swelling. Sprains occur when the tissue in a joint is twisted. To prevent sprains, select shoes carefully. Talk to a trainer about taping weak ankles or wearing an ankle or knee brace for extra support. Use the rice treatment if a sprain occurs.
The sudden tightening of a muscle is a muscle cramp.
Oh, I think I have a cramp.
Sharp pains signal muscle cramps. They are often caused by fatigue and dehydration. Taking precautions when exercising in hot weather and static stretching help prevent muscle cramps. Should they occur, drink plenty of fluids and gently massage the muscles that the cramp.
Ow, my shin! I think I have shin splints.
An overuse injury that results in pain in the front and sides of the lower leg is a shin splint. There may be tenderness over the shin and some swelling. To prevent shin splints, wear proper footwear, run on even surfaces. Begin and end your workout with static stretching of the muscles of the shin and calf. Ice can be applied 4 times a day for 20 minutes. Check with a physician before taking aspirin or other drugs to reduce pain and inflammation. Before workouts, put tape around the shins to keep them stiff and stable.
What are some common daily injuries that happen on a daily basis?
So we see a lot of strains and sprains. You know, a lot of ankles get twisted, fingers get bent. When there's that open basketball in the morning, I see a lot of fingers are hurt. So for a sprain or a strain,
How do you treat them?
yeah. Well, basically, ice is the number one. Ice and rest. But there's a thing we think of called rice. Rest it, ice it, put ice on it, compress it. That would be like an ice bandage. And elevate it, right? Put it up. So usually in school, we start right away with the rest it and the ice it. And then I have everybody, when you come in for ice, after the ankle, the finger, whatever, I'm always, especially anything in the lower extremities, the legs, we're always going to say to ice it. So, and elevate, so it's rice, so rest, ice, compress, and elevate.
And then how would you prevent them from happening?
I guess, you know, some of the things are just being a little more cautious, but if you're so active in gym and everything, things just happen. So I think maybe being a little more cautious, especially on the stairs, but when you're playing a sports activity, I guess a little caution, but those things happen, and just to treat them right away. Get that ice on it, and ice 24 to 48 hours.
Thank you.